guys, Dr. Lavan. So today I thought we'd address something that actually affects about 1 in 16 of us in the UK. Let's talk about diabetes. So figures actually suggest that by 2025 there will probably be about 5 million of us that suffer with diabetes in this country. So you may be actually managing your diabetes currently, or you may actually know a loved one or a friend struggling with it. Also, maybe you've actually recently been diagnosed, or you're just curious about diabetes, concerned about some of the symptoms, and hopefully this video will help. So let's talk about diabetes and see how we understand the pathology. So the best way I'd like to describe diabetes is really going back to what we call first principles and explaining it in a very basic way, because by understanding what happens with sugars in the blood, we can actually understand how this impacts our body. So think about your blood almost being like water. The water rushing around the body, reaching all the different blood vessels, all the different cells, various organs like your kidney, your eyes, and rushing back to the heart. Now think about the case of someone with diabetes, where this water actually replaces it with almost like a golden syrup consistency, so that thick, viscous feeling. Now imagine that flowing around the body. You can slowly start to imagine that this product going through the body, when it crystallizes full of sugar and starts to deposit in certain organs, can start to cause some damage in comparison to the water. Now it's this understanding, and the understanding that the sugar is actually filling up the fluid, and i.e. filling up the blood, that can have this damage on our body. There are two main types of diabetes, type 1 and type 2. Now, when we talk about diabetes, we're actually talking about an organ known as the pancreas, which sits behind the stomach and sits in the center of our body. Now, this organ produces a hormone called insulin, and it's this where, when problems arise from this, that leads to diabetes. When the pancreas doesn't produce enough insulin in the body, we actually class this as type 1 diabetes. And when we actually have insulin that is produced, but the sensitivity of it, or the way our body responds to it, where it doesn't respond as well, we class that as type 2. Now it's important to realize that insulin, the hormone, typically works in controlling blood sugars. So when there is a high level of blood sugar, there is more insulin that's released, and it takes that sugar and either uses it as energy or moves it on to the cells and the muscle tissue and stores it. So when we talk about micro complications, we're talking about the thin or small blood vessels around the body, typically in the areas of the eyes, kidney and feet. Now if we talk about the eye, we're talking about the area of the retina. Now sadly, when the high blood sugars reach these areas, it develops crystallization which can damage the area of the retina. Sadly, this leads to a destruction or a reduction in our vision and can lead to things like blindness. Now on to the macro complications. So macro meaning larger, and we're talking about large blood vessels, and these are areas of the heart. So unfortunately heart attacks are more common, and interestingly those with diabetes, we take it very seriously when they present to us feeling unwell, because sadly in these cases the typical effect of a heart attack, where we describe that central crushing chest pain that radiates to the left-hand side, isn't as common, and therefore when a patient is unwell with diabetes, we take that very seriously in case they have a heart attack. Again, another blood vessels or supply of blood vessels is to the brain, and sadly strokes are more common in this case. So this is a condition that is really worth taking seriously. However, good news alert, if we do find someone is having high sugars or we pick up diabetes, there's huge amounts we can do to try and bring those levels down to normal. And we have wonderful medications as well as good techniques in diet and exercise that can help. Urinating often. Feeling very thirsty. Feeling very hungry, even though you're eating. Extreme fatigue. Blurred vision. You may also notice that cuts and bruises are slower to heal than usual. Weight loss, and that means despite even eating large amounts, you're still losing weight, is quite a common feature in type 1 diabetes. Tingling, pain and numbness, in the hands and feet, which we briefly discussed, is also a common feature in type 2 diabetes. You're more at risk of developing type 2 diabetes if you're over the age of 40 or 25 for the South Asian population. If you have a close relative who suffers with diabetes, so that could be a parent, a brother or a sister, are overweight or obese, or Asian or from the Afro-Caribbean population, and that's even if you were born in the UK. So quite simply, your GP can diagnose diabetes very easily, and that's with a simple blood test, which you can have done at your practice or at a local clinic. Now, after the diagnosis, your doctor will encourage you to increase the level of your exercise and watch your diet, because this can go a long way in dropping those blood sugar levels. However, if we're still struggling with that, or the levels are quite high, we have a whole host of medications that work wonderfully well that we can use in this case. I've covered a lot about diet and exercise in previous videos, so please check out the bio to find out more about it. So once we start medication, it may take a little bit of time to get used to it. So until we find the right dose, please try and hang in there. You'll also have regular checkups. So regarding the eyes, you'll normally get an annual check. Regarding your kidneys, we're normally doing blood tests 3 or 4 times a year, and with your feet, your doctor will check your feet at least once a year. Also, ask your doctor about free diabetic courses, and we're all here to help with the practice nurses and the doctors ourselves. The more you know, the better you'll feel. So, thanks for watching, guys. Remember to like and subscribe to the videos, and stay well.